Rubber dam isolation. Here we go for the armamentarium of the rubber dam. Rubber dam kit contains a rubber dam sheet which has the dimension of 5 into 5 inches or 6 into 6 inches, and it has two sides. One is the dull side, the other is the glossy side. Always the dull side faces towards outside so that it can avoid the reflecting light, and the shiny side which can easily slip in when you push the rubber dam over the tooth. So as you can see in the picture video, you can see the dull and the shiny side of the rubber dam sheets. So rubber dam sheets are normally made up of a latex, and you have a latex free rubber dam sheets too, and it has a various colors. Next comes the rubber dam clamps. So there are various sizes of rubber dam clamps which is being used right from the anteriors till to the posteriors. The one which has been taken outside of the kit is also called as butterfly clamp, which can be used for maxillary and mandibular anteriors. The next comes the clamp which has been used for cuspids and bicuspids. The next which has been taken out is used for the molars, posteriors. And you have clamps even for partially erupted tooth or badly broken down tooth, which we call it as tiger clamps, which is not shown in this kit. And coming to the parts of the rubber dam clamp, you have rubber dam wing, a bow, and you have prongs on 4 aspects, which we call it as 4-point contact. And you have a small hole on either side where you can carry the rubber dam clamp towards for the placement. And when you see in the video, the prongs are bent down, which is called as active clamps, and the other clamp which doesn't bend. So the active clamps also has aid in retracting the soft tissues. So you can see a wingless clamp and winged clamp on either side, and which can be applied wherever you require it. And you can see all the clamps has been displayed. Starts from the clamps used for anteriors, and clamps used for cuspids and bicuspids, and clamps used for posteriors, both maxillary and mandibular teeth. So next comes the rubber dam clamp forceps. So you have an ivory type, and you have another type also, which is used to carry the rubber dam clamp for placing over the tooth. So you have the hole there in the clamp, and you can insert it, and you can carry it like this, so that and there is a lock in the handle. You can lock it, and while placing it, you can release the lock and place the rubber dam clamp, and check for the stability of the clamp before you place. Next comes the rubber dam punch. You have two types, Ainsworth and ivory type. So what you see here is an Ainsworth type, and you have a small punch, and there is a table with different diameters of hole, where you can select the diameter according to the tooth which we are going to place the rubber dam. So accordingly the dimensions, so you have to rotate the table and orient the punch. Next comes the rubber dam frame. So you have something called as different types of frame. One is Young's frame, which is a metal frame. It will be U-shaped, and you have the Young's frame in a plastic type also, which can be autoclaved also. Nowadays we have foldable frames also, where it will help in placement. So it can fold it while taking a endodontic radiography. So this Young's frame has projections on all the outer sides, so that you can pull the rubber dam and secure the rubber dam over the frame and stretch it, and it can be placed over the mouth. And there are variations, the combination of rubber dam sheet and the frame together, so called as optra dam, which is a retainer, less dam also. We can use wedges to secure the rubber dam sheet along with the frame in the tooth. Next comes the rubber dam template. So you can see the holes which is on the outer side is for a permanent dentition, and the holes which has been marked on the inner aspect is for primary dentition. So starting from the central incisors till the third molars. Next, before placing the rubber dam, we have to ensure the contacts with the help of a rubber dam floss. It is also one among the armamentarium. So you have to use the floss and check the contacts, how the contact is, whether it can be easily slipping. So the next comes the rubber dam clamp. With the help of the floss, you need to wind around the hole which is being placed on either side of the wing, so that it will be secured in case, for example, while placing or while operating in the mouth, if the rubber dam clamp fractures, so on either side there is a sling where you can, if it fractures, you can pull it outside so that you can avoid the slipping into the throat. That's the advantage of passing the dental floss over the clamp. Next comes the rubber dam napkin. So what is the purpose of this napkin? So you can place a napkin before you place the rubber dam sheet, because you can avoid the latex allergy and it can absorb even the moisture. Next comes the rubber dam wedges. So wedges can be used to secure the rubber dam sheet in the interdental area, so that you can do the inversion of the rubber dam very comfortably, and it will retain the rubber dam sheet in the interdental area. Next comes the lubricant. So here there are various lubricants, but what we show here is the Vaseline. So it is nothing but a petroleum jelly which you can apply on the shiny side of the rubber dam sheet